All right. So Oh, I was about to say good morning, good afternoon, good evening, everyone. Thank you for joining this community convo this evening. This is something that we're all really excited to talk about, community wellness. We understand that this is that time of year where we all think about um, what we want to do for the year and how we want to prioritize our health. And I know it's not an easy feat to overcome, but I'm really happy we were able to bring together a number of really great panelists for tonight for us to talk about what community wellness means to you and how we can support each other in accomplishing those goals. So I know I don't want to keep us from that really pointed conversation as we talk about safe movement, our stress and how we can keep that down, nutrition and making sure we're having healthy foods and access to them, and clinical care and what that looks like with speaking with our physicians. So before we get started, I do know we always love to ground the space and make sure everyone has a shared understanding of what community wellness means. So I'm going to pass it over to my team member, Tadese, and she's going to give us a little bit of a grounding and share language around community wellness. So I will pass it over to Tadese.
Good evening, everyone. As Ayana mentioned, my name is Tadese Apasampong, and I am a health equity scholar here at Vital Connections. And before we get started with our conversation and our panel discussion, I want to take a few moments just to talk through what community wellness is and why we're having a community conversation centered on this topic. So when we think about community wellness at Vital Connections, the term cardiometabolic health comes up. And cardiometabolic health refers to the overall health of the cardiovascular and metabolic systems in the body. And it encompasses a very broad range of factors related to heart health and metabolism. So some of its key components include the health of the heart and blood vessels, so thinking about your blood pressure or your cholesterol levels. It also includes your metabolic health, or how is your body converting food into energy. We're also thinking about physical activity, dietary habits, and other personal lifestyle factors. So maintaining an optimal cardiometabolic health is important in order to mitigate cardiometabolic diseases, which are things like coronary artery disease, diabetes, and hypertension, or high blood pressure. And we know that these conditions disproportionately impact communities of color. And when you consider why, it's important to highlight the social determinants of health, or the non-medical factors that impact someone's health. And as an organization committed to advancing health equity, understanding how we can better serve our communities and support our communities is critical. So today we've identified 4 areas that we believe are very important to community wellness. And so they include safe movement and physical activity, which just highlights the various forms of exercise that suit someone's personal preferences and abilities. There is nutrition and food access, which emphasizes the significance of a balanced diet, while also addressing disparities in food accessibility, given that food insecurity is a pressing issue. Stress management acknowledges the significant influence of mental and emotional well-being on health. And it's important to think about how to navigate stressors by promoting mental health practices as well as coping mechanisms. And then lastly, we're thinking about clinical care and how to foster strong relationships with your care teams and healthcare providers in order to enable early detection, effective management, and preventative strategies. But it's also making sure you're in an environment where you feel heard, respected, and valued in healthcare settings. So today we have 4 incredible experts here to share their expertise on these 4 topics. And with that, I'll pass it back to Ayana.
All right. Thank you so much, Tadese, for kind of setting the stage about how we talk about this topic. I do know we've got quite a few panelists here who are bringing a lot of lived experience and professional experience about the topics that we just talked about. So without further ado, I would love to introduce our 4 panelists. I would like to start with the wonderful Sam Williams. Sam is here wearing multiple hats and is an expert when it comes to understanding the wellness component of managing stress. I know that he is here to make sure that we understand what it looks like to think about some of these, what it looks like to, when it, I apologize. I'm trying to find you. Here you go. I'm trying to start trying to bring you up to the stage so everybody can see it. He has a number of things I know that he was sharing with us in the beginning when it came to some of the things that he is involved with when it comes to returning citizens, as well as the academic community with learning about wellness. So we're really happy to have you here tonight. Thank you, Sam, for being here.
Thank you and welcome. As was just mentioned, my name is Sam Williams, and I do wear a lot of hats, but I will just focus primarily on, I think, what we're here to really look at and talk about is community health and well-being. And in that space, I've been teaching trauma-sensitive yoga for over 10 years. Inside of the prison and in community. And similarly, for maybe half of that time, teaching meditation. I'm both certified in both of those fields. And more importantly, in addition to those things, dieting, exercising, fasting, those things combined have really helped me to changed the whole makeup of my life, my thinking. I'm a survivor of everything I think a human being can survive on this earth. And I'm blessed to now be able to pass these practices along. Last thing I would say is my philosophy for the work that I do is really centered in the practice of health empowerment. And my vision is to help to put health empowerment practices in the hands of people so that outside of needing an instructor, we all can be able to activate and use these tools and practices on demand. So I'm happy to be here and excited to talk a little more as we go on.
Awesome. Thank you, Sam. So the next person I would love to bring to the virtual stage is Sonia Carter. Sonia is here as our nutrition expert. She's coming in from the Boston Public Health Commission with years of experience around nutrition and food access. I believe, I know that we've worked with her a number of times through our food work here at Vital Connection, so we're thankful that you're here in the space today. So feel free to just say hello to everyone and share a little bit about what you're bringing into the space.
Hi, everyone. I appreciate you invited me to attend to have this beautiful, wonderful conversation. And I love that we're talking about a conversation because much of my years in presenting and teaching nutrition education is always like in the past being a lecturer, right? And I love that we are moving away from that and that we're having a conversation. I've been in Boston for many years, partially grew up here and went to school here as well. And one of the things that I recognize a few people on the call, and they know that my love for food and more so understanding that whole intersection between culture and food and how we can maintain our health by still enjoying the wonderful experience of eating our food and not thinking about like the diet mentality around food. So again, thank you. And I look forward to having this conversation with you.
All right. Thank you so much, Sonia. Next, I'm going to bring up Kristene Tadese. She is a resident over at Brigham and Women's Hospital. So she'll be speaking to us about clinical care and your care team and how to have those conversations. So Kristene, thank you so much for having us here. Having you with us. And please feel free to say hello to everyone and what you're bringing to the space today.
Hi, everyone. I'm Kristene Tadese. I'm one of the residents at Brigham and Women's Hospital. I'm so honored to be here. I'm really passionate about learning from the community and partnering with community to improve all of our health. I think some of the greatest lessons that we can learn are outside of the hospital and outside of the clinic. And I think our strongest power is together and working together to change health disparities and create the health equity that we all want so much. So honored to be here. Really excited to talk about ways that you can feel empowered to have conversations with your doctor about things that matter to you, and feel empowered in taking charge of your health.
Thank you, Dr. Kristene. And finally, I'm going to bring up Kay Savage. She is an active living and environment coordinator over at Mattapan Food and Fitness Coalition. She's here to talk about how we can move safely and get right, as we like to say. So thank you so much, Kay, for joining us. Feel free to say hello and share what you're bringing into the space today.
Hello, everyone. My name is Kay Savage. I work for Mattapan Food and Fitness Coalition as their activity coordinator and environment. I also do personal training on the side in group fitness. My passion for that came from being almost 330 pounds and not having the best health, and being a single mom, not finding that work lifestyle balance. So I decided to change my life around and get into fitness. And I try to promote different ways to engage in exercise, even if you have mobility limits, and still being able to move no matter what age you are. So yes, I can't wait to discuss and show you guys also some nice movements you can do at home in under 30 minutes as well.
Oh, who thought that you were going to come in here and get a mini workout, right? So thank you to all of you for being a part of this conversation. So let's just jump in now that we all know each other. So I know from what Tadese had shared before, we use the term cardiometabolic health as a holistic term to describe community well-being through the prevention of the chronic diseases that we listed before. So for you all, how do you define community wellness? And it's a conversation, so feel free. I'll let anyone start us off.
I'm happy to start off. I think that as Tadese mentioned before, there's so many different things that make up community wellness. We all know about like the clinical aspects of it, things like blood pressure and diabetes. But I think wellness is so much more than that as well. It's, whether we feel like we can do the things that matter to us because our body can actually move and function, whether we can be in people's lives or whether we can be, go to church or go to mosque, whether, we feel like if we were to get sick, that we would get good quality care. It's just the thriving, the health, of community, both bodily and in our ability to interact with each other.
I can go next. As I think of of wellness and wellness in the community, a while back as I was studying, I remember a professor said to me, like nutrition education was not the only thing, right? That there are so many other factors that prevent our community from being healthy. having healthy foods. And, we think about the social determinants of health. So, to have a community that like is really well and is focused around wellness, we can't help but try to address some of the other issues of food insecurity, which is affordable housing, health insurance, as Kristene mentioned, and also, education and all of those other factors that impacts our wellness. Once we can move beyond that, then we could think of a community that is really healthy, that we have the parks that we have access to. We feel safe walking to those parks. We have access to healthy foods, and that we could afford to purchase those foods. So that is like somewhat of like the thriving community that I think that we're all here tonight working towards.
Well, can you say the question again?
How do you define community wellness?
Okay. So, for me today, I think about growing up in the city of Boston, a child of an immigrant parent who only had a third grade education, and having to be taught through the public school system and taught in community. And I could say I made a lot of mistakes and didn't have the type of guidance, support, and and I had some probably dysregulation issues myself when I was a child. But I think today when I think about community wellness, I'm able to think about it in a couple of ways. One, I have a more expanded vocabulary about myself, about community, about institutions, about the history of the city of Boston on every level, the racial, period that the city have went through, and children and families. So for me, the vocabulary I have today for health and wellness, and more deeply, the vocabulary that I have for my own self, and then the language. And then it's kind of like what everyone just said, how do we, understand, the many very powerful institutions that make up the landscape of Boston and the greater Boston area. And what does that mean in regards to environments? And then there's one other issue that oftentimes don't get enough, is the environmental related kind of pollutions that exist in the air, that exists, through carbon emission and vehicles. And those are toxic chemicals also that permeates the body, and they're invisible, so we don't even see them, but they exist in a lot of, especially in congested cities. So, the more I become more aware of self and my environment and these institutions, and then my own well-being, right? How I didn't know how to take care of myself, how I thought junk food and hanging out and doing all of the stuff that was cool was the way to go. And years later, I see a lot of people who did that with me who are not in very good shape, and some are not with us today due to physical complications. And so I see it as an accumulation of things, but I do think grounded in knowledge of self, and then knowledge of, and I think community can help reinforce both of those learning processes. So that's how I would define it in my own personal way.
Yeah, thank you. And thank you, all of you, for thinking about that. I know for me, when, reaching out to everyone, I even thought about it myself, about how I define it. And I do know, with, thinking about family history and finding that out, and figuring out like who has, a history of diabetes down their line, who, has had cancer, who's had high blood pressure. What am I eating to make sure that I don't, bring on those things, and how can I reduce the risk myself? And sometimes, it's also about finding that village, right? This is a community issue and a community solution, right? Finding those people that can support you to find your solutions, whether it be someone you take a walk with, whether it's, knowing who your care team is and having those quality conversations, it definitely does take all of us to find that solution. So thank you for bringing those things up. I guess one thing that does come to mind when we're thinking about, defining community wellness, what are some things from, your experience that you think is missing from the conversation or from the equation, if you will?
Can I say something? Carmen is my name.
Well, I know we're listening to the panelists right now. If you want, you can feel free to put that in the chat, and we are going to have opportunity to. Oh.
Sorry, I just didn't know you were just for the panel, so I just want to apologize.
No, it's okay, because there's going to be an opportunity for us to do an actual hands-on conversation during our breakout sessions after the conversation. So feel free to hold on to that thought, and we can come back to it then.
I can take a shot at the question around what's missing.
Mm-hmm.
So because of the many layers of work that I do, I've been forced to learn about nutrition on the deepest personal level that I can, both using root products and fasting, and similarly in the clinical capacity. So I'm very familiar with physiology, anatomy, trauma, the brain, all of those things, right? So, I believe especially those who are on the ground, who I would call the helping professionals, who might not have that training and educational background, I still think that there is a need for as many of us to have, a clinical understanding of some of the basic things about the body and mind, a nutritional understanding about the basic things about the body and mind, and understanding about trauma-informed practices and how that relates to all the spectrum of challenges that we deal with. So I study cognitive neuroscience. I study neurobiology. I study, like, the books behind me are all a makeup of every one of the sciences that I can think of that's related to healing. And I don't think everyone has to be that excited about reading like that, but I think there's a basic awareness that I think is necessary to be able to best know how to support or even put practices in places that can even help our own well-being.
Thank you, Sonia. Kristene, anything that you're thinking about that's missing from the equation?
Happy to jump in. I completely agree with that. I think it can be really easy for there to be this divide between, the people at the desk with the stethoscope and patients, and feeling like, oh, well, only certain people have the expertise. But I do think it's really important that we learn from each other. I think patients oftentimes do know their bodies really well, and so they bring that knowledge, and doctors, nurses, PAs, they bring the anatomy, physiology, and things that Sam was just mentioning, but there's a lot of education that we should be doing with each other. I think the other thing that I wanted to mention was it's really easy for these conversations to kind of get stuck in this idea of personal responsibility, which I think is important. Like, we should feel very empowered to, take control of our health. But at the same time, I think it's important to recognize the landscape that all of this is happening in, and the fact that, we're not here on accident, and that there are a lot of policies and history that have put us in the position that we are today, where certain neighborhoods are difficult to walk in, certain neighborhoods it's hard to find a grocery store, the fact that certain foods are available to certain neighborhoods. I think there's a lot that we should be thinking about when we're thinking about how can we as a community become more well, that is outside of just medications, or even outside of okay, I need to exercise more. We should also think about you know, how can this landscape look better for all of us, and you know, what are things that we can kind of demand of the people who are leading us, and people who are in clinics and people who are in government, to make it more easier, make it easier and make it more natural to be healthy in this world.
I think those are some really great points that both of you made. And I think it is sometimes easier for us to talk about. So as the nutritionist here, we could talk about, like, you know, I want you to eat healthy foods. I could tell you the healthy foods to eat, and, you know, I could do that. But I really think, and I've also been around a while now, from those of you who know me on the call. And so my frustration is that we don't have that sustainability. Like, we keep going around in circles. So we talked about, like, policy. So we need policies that are sustainable, so that we don't find ourselves back here in the same place in the next 10 years, because this happens all the time. And so that is the key. So it's advocating for policies that are going to be sustainable in our community, so that our community can continue to thrive. Our community knows how to thrive. In conversations with many of the folks in our communities, we know how to eat healthy, right? But there are all of these systemic systems that prevents that. And so we need to be able to advocate for those policies that's going to help our community to continue to thrive and be well.
Yeah, thank you. Thank you. So I
Can
think we've done, oh, go on. No, go.
can I say something to what was said out of love and support, and just how I view um, this thing about sustainability? I do believe that systems and leaders and structures should be more responsible for the people. And I would always say we keep pushing and keep getting them. And I'm also always aware that, you know, for me, I'm always trying to put the practices and the tools in the hands of the people, because in that way, whether systems come through or not, if people have the practices and the knowledge that they could administer in their own lives, you know, we then are control and can continue to control the direction and the quality of our health, right? So I take a very self-directed approach, because again, we know systems historically has failed many generations before us, right? And we'll hope that systems in this generation don't fail the children and those of us who are in it. But in case that might be the case again, I think people understanding the power that they have within themselves to do some basic things that don't have to be, you know, skyrocketed. There's some things that we can do every day in some way that can help improve the well-being and the sustainability of our health and our bodies. And that's why I was saying earlier, when I started to do what I do with my meditation every night, it wasn't right to just get people to do meditation every night. The design was, if I can get people to be in practice regularly long enough, then eventually, like anything that we do, right, it becomes a natural part of us, right? So I was trying to get people to practice and then take it on and not realize that it's not my practice anymore. It's yours. You can use it anytime you want. So, so I do believe the sustainability of both the system is important. I'm always cautious that sometimes the system don't come through when we need it. So empowering people to always know that they can drive their health and betterment. And I know it's easier said than done, but I just wanted to say that. So not to take away from what you said, because I do believe systems need to play a role in helping to correct some of the challenges that we're seeing.
I totally agree. You said it beautifully. So I agree. Thank you.
All right.
And thank you for bringing that up, because I know when we think about all these components, they all work together. They're all impacted by things that precede us. So it's really great to have that conversation about how that comes into play. So thank you both for engaging in that piece. So So I kind of want to, since we do have you all here, and we know that you know what you know, and that's why we have you here, our experts. I want to make sure that I kind of get to some of the core pieces of this conversation, which are the four categories that Adene brought up when she was giving us shared language. So I just want to kind of, talk to you all really about some of those pieces and kind of bringing your expertise in the space. So I would love to kind of take a deeper dive when it comes to fitness. So Kay, this one is for you. How do you perceive the relationship between fitness initiatives and their impact on health? It's okay. I know, one of the things we learned from Zoom is how to overcome technical difficulties. So here, give yourself another shot with coming off mute, because I think you're on mute right now.
That I couldn't hear you. If you could tell me that again.
So I know you came in a little choppy for us, but I'll ask the question one more time and we'll try it again. When you're looking at fitness initiatives in the community and folks, like New Year's resolutions, things like that, and other initiatives that are happening around town, explain the impact that physical fitness has on your health.
I want to say the impact that physical fitness has on your health.
Mm-hmm. Yes.
Okay, sorry. It's
okay.
my internet
No, you're
is
good.
not my friend today. The physical, the impact. It's important for me. I feel like fitness came in handy. I was feeling depressed, being a single mom of 2 children, and working those New Year's resolution or still little 30-day type of fasting or detox, all being physical played an aspect in that. Just walking helped, being out in the fresh air. You may not even notice it, but you can go far because you got your music on, or when you're out with a partner. Just having that girl talk, physical aspect of walking helps. I've walked miles with my best friend, just not even noticing that we've gone from one end to the other just because I needed to get outside and walk, and just the talking helps. Movements. When you're older, it helps with your limbs, being able to be mobility, sitting down, bending down to pick up things, catching your balance. Just little exercises you can do in your chair, at home. Any type of physical movement is essential to your health and overall mentalness as well, is how I feel.
Awesome. Thank you. So let me pivot over, because I know with that you talked about even with those like fasting crazes and the ways that people try to pair their diet with those fitness plans. Sonia, what does nutrition mean when it comes to wellness in our bodies?
Well, the first thing that I like to tell folks is to, give yourselves a break. There's so many, you mentioned, there's so many different diets, and I prefer to think of like eating a pattern of food that you're accustomed to, whatever that might look like, right? And giving yourself a break, and just feeling comfortable recognizing like some of those foods that we know that are really good for us, like eating like fresh fruit and fresh vegetables and stuff like that. But also, as I said, giving yourself a break, because if you don't have access to fresh fruit, they're still frozen, that is also healthier. So really starting to kind of gain that knowledge about what is healthy, and then what you afford or what you could have access to, that there's so much variety out there. And I spend a lot of time with talking to parents with children and trying to, you know, like explain to like families this, like, you know, if your child does not eat broccoli, that doesn't mean you have to force the kid to eat broccoli. There's, you know, there are other foods. They could eat tomatoes, they could eat mangoes, they could eat the wonderful variety of foods that are out there. So again, I focus a lot on telling people, hey, you know, like take that break on yourself. Don't, there's so much, and we have access to so many different foods. You know, how can you utilize those? And probably not, if you don't want to make a New Year's resolution, don't make a New Year's resolution. Again, give yourself a break. You know, there are wonderful foods out there that you could eat. And I like to focus on what do you think you want to eat, and how can I help you understand what are those foods that are going to be more beneficial for you, as we talk a lot about cardiometabolic you know, diseases and so forth. And I think that is my role right at BPHC, to think about like, how can I help people understand how to control, how to prevent and control some of these diseases.
Yep. So you heard it here first. Skip the New Year's resolutions if you don't want to do it. don't feel pressured at all. You've got the commission telling you that. So you got
Yes,
permission.
I believe in setting smart goals for yourself, right?
Yes.
And that's about it.
Yes, thank you. Thank you. So Kristene, I think with this, and you know, thinking about, you know, the conversations we have with ourselves and wellness, I think we've really come up to a very important part of our health journeys, which is having conversations with our clinical care team, right? I know that it can be very intimidating to in that short 15-minute window when we're talking to our doctor about what we need, what hurts, what doesn't. How can we have valuable conversations with our doctors and the other folks who take care of us?
Such a good question. I think it can be really hard, like you're saying, in such a short period of time, but something that is really valuable is really leading with what matters to you in your life and in your health. So, you know, things like blood pressure and sugar levels and, you know, heart health are all really, really important just in and of themselves, but I think they're also really important in the way that they impact our ability to live our lives. And so, you know, if there's something that really matters to you, so whether that's actually being able to spend time with your grandchildren or being able to like go on walks with family and friends without feeling short of breath, those are really important things to mention because, you know, your doctor will hopefully already be addressing all of those really key aspects of health and, you know, measuring things and sending you to get blood work. But it really helps to tie in all of those measures with things that matter to you. And it also helps to motivate you because if you know that, you know, eating healthier, for example, is going to help you to be able to be more active, or if you know that going on one walk a day could actually improve some of your joint pain. Things like that, I think, help to keep doing those healthy habits. And then the other thing that I would say is really just asking your doctor, like, are there a few things that I should absolutely know? Like, what are if I was only going to work on 2 things over the next couple of months that would really help me to be healthier, what should those 2 things be? And I think things that, you know, as a medical community, everyone's really focusing on right now are things like cardiometabolic health. So things like your sugar levels can affect every organ in your body. Things like your blood pressure can affect every organ in your body, especially your heart. Things like your cholesterol levels similarly can affect your brain, can affect your heart. And so even if you just pick 2 things that you are really going to focus on, so when I see you in 6 months, I really want my sugar levels to be down to here. I think that that's a really helpful way to partner with your doctor. And, you know, you're playing your part and they're playing their part, and you can actually make a lot of progress that way. Whereas I think a lot of times it can be really overwhelming to try to think about everything and like, oh, well, you know, like, what about my memory and what about this? And what I think, you know, there are a few things that really can help our entire bodies, and it's great when we can focus on those.
Thank you for that. So we've covered being physical activity. We've talked about how to talk to our doctor and the things we put in our body. But I always feel as though the mind, it controls it all. So Sam, please share with us with your experience with working around stress and mindfulness. What is the mind's impact on our overall wellness?
I would say everything that was mentioned already, they all interrelate in so many ways: diet, movement, the types of foods that we put into our bodies. One of the things that when you talk about stress management in the body is that, you know, the environment in itself plays a major role as a stimulant, right? And the body is constantly responding to the environment, right? So when it becomes more specific to survival, when it becomes more specific to safety, when it becomes more specific to um, meeting the needs of self or family, those stressors start to, you know, they start as internal forces, but as external forces, and they impact you internally. So with the mind, you know, you're talking about without getting into medical terms, you know, how the body and the brain interacts with these stimulants. And when these stimulants are steadily being engaged, that creates stressors, right? And stressors not only impact the brain, the cognitive, but it also impacts the body, right? The muscles, the tendons, the tissues, the joints, and all of that stuff. So what I've learned both in my practice and in study, if we can develop the type of practices in ways of calming down the body, right? And so when you calm down the body, you're also using less energy than you're using if you are active and doing all of the things in the world that you do. So when you calm down the body through breath work, through mindfulness, through just sometimes sitting in silence, right? That also impacts your nervous system, right? And if you can bring the nervous system back to a calmer place. So a lot of what I've learned just through the power of breath and bringing more oxygen into the body and sitting still really helps to create space, particularly in the brain, because when you're excited, when you're angry, when you're reactionary, and it's in a deep state, you don't have access to your executive functioning, right? It isn't until you calm your body back down that you can make rational decisions and think about, you know, plan A, plan B, and plan C. When you're excited and dysregulated and hyper aroused, it's hard. So I think, you know, in simple terms, figuring out ways to relax the body, calm the body down, especially when you're triggered, especially when you're worried, especially when you get news that you weren't expected to get, you know, a lot of those things. And our being triggered is instinctual, and a lot of it's involuntary, so it happens outside of our awareness, right? The body is designed to survive itself, to survive itself. So some of the practices, you know, the breathing, the sitting still, the movement, in synchronicity with the body has been some very powerful tools. I don't want to get into the medical terms, as you know, it gets too kind of, but I think in so many ways, it's relaxing the body, where that you can access more of the higher level functionalities when the body's more relaxed.
Definitely. And I think one thing that you said that really makes me think, um, I believe when it comes to how all these things are connected, we understand that we also bring a lot of learned understanding for who we are as individuals, um, whatever culture we belong to, and all the other intersections in between. So this kind of question will go to everyone. Feel free to chime in how you feel, how it moves you. But with this conversation, we're looking at these wellness resources and how the impact on the body. But what are some of the obstacles that you've seen in your professional experience with accomplishing some of these wellness goals? And how can we, as leaders in the space, as community members, how can we kind of look at these cultural barriers that we have to accomplish our wellness goals and make sure that we're making an all-inclusive wellness solution, because we know Boston is very diverse. We've got folks from all over the world that speak a number of languages. And I just think that, a solution isn't one size fits all. So, what are some of the barriers that you see out in the community and in your professional experience? And, how can we kind of make sure that we're addressing those cultural barriers to make an all-inclusive solution?
Can I go? And I'll be real quick. There's like maybe two or three, but I'll be real quick. So one of the first barriers is what I offer to community and what I've been offering, it's free. If you have a smartphone, a computer, you have the time, space in your living room or wherever, and the mat, it's free. So I think most people think that I'm trying to sell them something, right? I'm trying to get you to participate in a membership. Eventually, I'm going to come around and ask you for some money. Anyone that knows me that's been engaged with me over the last 4 years, we're free. So my meditation and yoga is free. The other thing I learned early is with meditation, I think, sometimes I might use a mantra, right? And I've had folks who, come from very strong religious backgrounds who might feel like the mantra, and like my mantra would be inhale peace, exhale love, right? And so I say to them, like, because meditation is really just about breathing, intentionally breathing, and really. And so I say, your mantra could be inhale God, exhale Christ, whatever.
Because they said,
Right, whatever might work for a person's belief. And then the last thing I would say, so free, it's spooky aware, there's something I know, right? And then the last thing is for the brothers, for the men, there's this idea that yoga and meditation is for women. I would say I practice with a lot of brothers who unfortunately they're not free, right? Because they're incarcerated, who participate in these programs regularly. So some of those barriers, I think, oftentimes, I think, get in people's way to try it, check it out. And again, not all of these practices work for everyone. But I think checking out a variety of things that are available might land on you in a way differently than you imagine.
Thank you. Anyone else have any ideas when it comes to, addressing the cultural barriers when it comes to achieving wellness?
If I have a comment.
Oh, sorry. Mm-hmm.
Hello.
Oh, the for this part of the program, we're just going to have comments from the panelists, but I would say hold on to it because we are going to have a part where everyone can speak, and that's coming up very shortly. So if you want, feel free to either put it in the chat or hold on to it because we're going to get into our mini sessions, and that way we could start to really open up the conversation around what we're hearing. So if you could just hold on to it just a little bit longer, and then we'll be able to open up the conversation. But Kay?
Yep. You were mentioning like barriers in regards to wellness.
Yeah, cultural barriers and wellness.
I know a big thing would be for, I feel me, growing up in an Afro-Caribbean household, therapy. Not something that is spoke upon a lot, and something that I truly feel helps with wellness. Just being able to speak to someone that's outside of your inner circle who can give you a different aspect on things that you're going through when it's starting a new journey. I'm happy that I was able to get a therapy in a time in my life where I truly needed it to be able to change my lifestyle and understand that, you know, I can still have some curry gold and some oxtails, you know, but I gotta be limited on it, you know, but and it helped me look at achieving the goal I needed to achieve with losing the weight I wanted to lose in a different light instead of just seeing it as, oh, I can no longer eat these things anymore. In my head, it's like I'm giving up something, I'm giving up a part of myself when in reality, I'm not. Um, you can still have all those foods and be healthy with it and not feel like you're giving up a part of yourself. So I definitely feel like those are barriers. Even with single moms, I tend to like to try to work out with more single moms when it comes to my personal training, only because they feel like they can't get that balance in their life because I got to have a job or I'm working two jobs and I have the kids. They got to go to school. I got to take them to camp, basketball, but you still can find that balance because I've been there and I've gone through it. I offer virtual classes where you can take 30 minutes and be right there in your house with them kids running wild in the background. And we're gonna do these squats and we're gonna do these jumping jacks and we're gonna get it in. So those are definitely barriers I feel are aspect within the Caribbean or Black and Brown community and with single moms as well.
I just wanted to quickly jump onto that and say, I think similarly, for people who are juggling so much, like you're taking care of your whole family, a lot of times, like you're the dependable person that everyone is leaning on. It can be really hard to prioritize your own health and even just find time to get into a doctor's appointment. But things that are increasingly available are things like phone visits, video visits, and that's something that I think can be really like practical and helpful if you know you just don't have the space and time to get physically into an office, a doctor's office, but you know there are medical conditions that, you know, are worrying you or, you know, could hurt you or even hurt your family in the future. I think even if you can just have a phone visit and kind of bring up those concerns, that can go a long way in not letting things go too far, too long.
And just to add quickly, I always have to look at the kind of systemic view. And I think really the challenge and the barriers that we face is that we work in silos, right? There are so many resources out there for the community, but a lot of people don't know. And there are reasons why they don't know. It's not because they don't want to know. It's because, as we heard here, there are other challenges. They're single moms, they're moms who are busy, they're working, they don't have time. Like they may not know of Sam's, session at 9 o'clock, or they're too tired, they have to, help their children, with school work and stuff. So there's so many there are a lot of really big challenges out there, and I think part of that is as I always think of like big systemic changes is that we work in silos a lot. So and it's wonderful what you have here tonight, right? You have the clinical view, right? And you have nutrition, you have health, you have a little mental health and so forth. And we all need to really work together or find some type of system where we could really reach every single person in the community and that no one is left behind, right? And as I think we mentioned, there are all of these resources, but not everyone have access. There's some language challenges as well, right? Our community is a diverse community that's made up of folks from so many different countries speaking so many different languages. And sometimes like those folks don't always get access to the resources that we need. So I think that is a challenge, and that is what we need to do a little bit more work on, is how can we really collaborate together so that everyone have access to everything that is possible for them in the Boston area and beyond. Because we have schools there that are not only from Boston, but
right,
beyond.
Right.
And I'd say one more point just to, and I know the
go ahead. No, Sam, I know you're overflowing with information. Go ahead.
No, what Sonia was saying in medical terms is called the multidisciplinary care model, right? And I was just thinking, man, what if we can take a multidisciplinary care model and apply it to the community? Because that's exactly what we have right now. We have medical, we have nutrition, we have physical movement, we have body-based. This is a multidisciplinary care model that I know we can replicate this on the ground in the community. So when you said that, Sonia, I was just thinking about this the other day. Okay, so how do I make this happen? Because it does take more than one of us or a few of us to really address kind of the holistic challenges and complexities that exist in community.
Yes. And you know what, Sam and Sonia, you definitely hit the nail on the head, because my last question for this portion before we open it up and go into our mini sessions, I definitely wanted to talk about collaboration, right? Because we're all here to have a conversation about, what the community and wellness looks like, how we all can work together. And I know here at Vital Connections, we've done a lot of great work around our community health hubs. And we're looking to bring them back, right? Because we understand that, having this multidisciplinary, intersectional, collaborative model of making sure that we have health right here in our communities, because we own a part of the solution. I know that's why I'm here, right? Because I believe in these conversations, I believe in the empowerment, and I believe of giving people direct access to the things that they need and deserve, right? So as I know for Vital Connections, and I feel as though we're all a part of Vital Connections, right? Because we all want to work together to create that solution. What does collaboration look like to make sure that we're bringing these wellness solutions to the community? What does it look like for us to involve community members and the organizations and hospitals that you all represent? What does that look like to you when it comes to creating a space in community that's a solution for wellness?
I believe first and foremost, it's about relationship. If we don't know each other, there's a less likelihood that we'll trust to invest in something more deeper. And I think being in Boston all my life, going through the Boston public school system and working with just about everyone under the sun that's out there today, part of the fragmentization and the competition and all of the rivalries, a lot of it is everybody working on their own behalf, even though everyone's trying to do well, right? But really figuring out one, getting to know each other, because it's a small city, but you'd be amazed how many people don't even know each other, never mind the history and the different time periods that things have shifted in the city. And then from that relationship, really thinking about how we complement each other. We don't all have to be experts, right, in all of these fields. I messed up big time as a young man. I'm a dad today. I have a powerful, 24-year-old daughter who I raised independently, but I had to go through the grind with that. So we don't all have to be experts in manhood and womanhood and nutrition, but if we can see the value in all the different complexities and expertise that we have, I think we can have a more exponential impact on our community. So I just think it's really about getting to know each other and figuring out how we complement each other in the work that we're doing.
Yeah, thank you. All right, so any of our panelists have something to share with that before we go into our mini session?
I think Sam covered everything. He touched over everything. That was a great example, Sam. But also just to piggyback on what he said, it's also just knowing the information is available, like how we jumped on this Zoom, like introducing each other and knowing like what it is that this person does versus just being on the Zoom and you're like, oh, what was that woman's name? Like taking the time to actually take the notes and know who you can connect with and how to get connected with that person. So I think that plays a big role in community partnerships as well.
Thank you. Anyone else? Sonia, Dr. Tadese, Kay?
I just think quickly, you've done a really beautiful job tonight of what that could look like by who you've invited here tonight. So we have the community, we have folks from different different areas in the community, and just feeling comfortable in bringing people into your space, but having people understand when they come into your space, what you're looking for and that they're here to support the community. And when I'm talking about others, I'm talking about universities, I'm talking about government, state and local. I'm thinking about all of those systems that they need to be invited into to our house, right? And they're welcome, but they also need to understand like who we are as a community. And I think that will help to break down some of the silos and to form more collaborations.
Yes. So I think this is a good place because I know that we've got folks who want to add to this conversation, and I'm ready to listen and to talk and take notes on how we can build these solutions. So first, I want to say thank you to our panelists for sharing your expertise and sharing your thoughts, because I think it's really important. I think each of you with the categories that you covered are important pieces to the puzzle, right? But it's definitely a big one, right? Because I feel as though each of us are pieces of it. So as we go into our mini sessions, just to kind of explain to everyone here, I'll be opening up some breakout rooms that that align with some of the topics that we talked about tonight: clinical care, food and nutrition, stress management, and safe movement. For some of the folks who registered before today, I know some folks gave priority to which one they would want to go into. So I'm going to open them up. And then you'll be going into your room. If after this conversation tonight, something is moving you and you want to move from room to room, that's fine. But we would love for you to sit in a room so you could be a part of the conversation. So just to let you know, we do have 4 community ambassadors that are going to be here to help facilitate some of these conversations. So just to kind of make sure that they're seen and you know who they are, because they're wonderful community leaders in their own right, and they're going to be supporting us in this conversation tonight. So first, we have Nakia Shell. She's from Mothers for Justice and Equality, and she's also a part of the UCB network. She is one of their coordinators. So thank you, Nakia. We also have Rick Henry, who is a part of our MFAC coalition, and he's done some great work in the food space. So I'm excited for him to lead a conversation here. We also have Rebecca Riley Green, who is another MFAC community leader. She's got a lot of experience in the clinical space as well. So I know she's going to do a great job with leading that conversation. And I am scanning my Zoom to make sure we get our last person up here, because I want to make sure we shout everyone out. Here you go. Yes, Daquana Harper, and she's going to be helping Sam out when it comes to talking about stress management and wellness. So I am going to open these rooms, and everyone feel free to join your room. And we will come back in here at 7:45, and we will kind of share some of the takeaways from our conversations. So I will leave it up to our wonderful facilitators to lead the conversation, as well as our panelists who will kind of help guide and give some tips along the way. So feel free to enter the breakout rooms. If you need help joining one, feel free to ask and I will help add you to one. But otherwise, I will see you back in the big room at 7:45. All right, so we've had our rooms. We've had a lot of great discussions. I know I was kind of popping through each room to kind of hear what everyone's been talking about. And I wanted to stay in each room, but I couldn't. But definitely wanted to bring us back to make sure that we kind of do a quick share out of some of the things that we discussed. I would love to kind of hear from our facilitators from each room just to share some of the things that was discussed in your room when it comes to community wellness and opportunities for solutions. So let's see. I know we had quite a few rooms going. How about Rebecca? I would love to hear what happened in the clinical care room. Feel free to I'm going to bring you up to the virtual stage so that way you can share with everyone what your group talked about.
All right. So we had a good conversations. A lot around, being able to talk to your doctor about questions with your care, or maybe a diagnosis you received, a medication that you were prescribed, and questioning, if this medication is for one thing when you read about it, and I have something else, why do I have this medication? So just like how to have those conversations with your doctor, and feeling like you're in control of your visit or your appointment. And it's, it's okay to ask those questions. You should ask those questions if you're worried or concerned about what's going on with your health. Another something else that came up was knowing how to get access to different studies and resources that are available. Like, better ways on, like, where do you go to get that information? There was someone who is very interested in joining different studies and often finds that they're not eligible based on their conditions, and how to, continue to look for different studies or more information.
That's a good point. Thank you for bringing that up. All right, so let's see who else. Let's hear about what happened. I know I saw a lot of stretching and meditation in the stress management room. So I'm going to bring Zaquana up here to share what happened in that room.
Hello, everyone. Yes, we got into our calm state. Sam led us through a meditation, which was actually really interesting because one of the things that came up was meeting yourself where you are. And I know that somebody else on the panelists brought that up of being kind to yourself. And, if you're, because some people may have certain like disabilities or limitations when it comes to physical. So, being able to just breathe, if not having to do, things that others are doing, just work on like your capacity and be within yourself. I know that we also talked about resources, the availability of resources, as well as the costs, therapy and, other counseling sessions do have a high price. And, Sam also mentioned that as one of the reasons why he basically provides his resources for free so that they are accessible. Also, being able to get to them, making sure that they're within the community with people that, kind of understand us, understand what you're going through and kind of resonate with your problems. When you think about like diversity within the mental health industry as a whole. And also we said, like, believing in yourself, like, you get to a point where you know that there's got to be more, and kind of following that longing, that curiosity, saying that, you may not get it the first time, the first resource, but if you continue to kind of believe in yourself and just say that there's got to be more and talk to people, that great things can happen. Oh, sorry,
Thank you,
can't.
Diana.
Yep. Hey, you think all these years of Zoom, I will remember that. But I was saying, thank you, Taquana. I saw another room with some stretches, our safe movement room. So, Nakia, please share what was going on in there.
Oh, well, thank God I was so quiet over here because I was on mute the whole time. So, can you guys hear me?
It's a little broken up, but we can hear you. So just give it a shot.
Okay. So in our breakout session, we actually talked about some of the same things that the quantity room talked about. We talked about also meeting yourself where you're at and just having the knowledge of knowing that you don't need like this expensive gym equipment to start your journey of making sure that you're practicing safe movement and healthy activities for yourself. We talked about just holding yourself accountable and knowing that when you do start something like this, just being committed to it. Kay showed us some different examples of chair exercises that you can do at home, but you don't need any equipment for. You don't need, you can do these things while you're watching television or while you might be doing another activity, also things that you can do at work. We also discussed different places that you can go to. People shared their resources on different organizations who have these type of things going on and how to get involved and access that. Kay also shared her information and was open to reaching out to anyone who was looking to get involved who might want to discuss that further outside of the group. And we kind of went over time with our stretching. So that's really all we got to cover.
That's okay. Got a mini workout. Like I said, everybody wasn't, that was a bonus. So big shout out to Kay for bringing that into the space. And then finally, I know the times that I've peeked in and out of the food group, I definitely wanted to say. So Rick, come on up to the virtual stage and let us know what we can do about nutrition and what came out of your group.
We talked about community wellness. One of the things that some folks talked about was that communities are not what they used to be. Like, it takes a village, that type of stuff. Like some people were talking about like stuff like this. They're more acquainted and know people better when things like this happens. By the way, some members in the group were talking about this this whole thing we're doing here tonight and how great it was, and we need more stuff like this. So it's a plug. But folks talk about being more in tune with stuff like this, as opposed to even knowing who their neighbors are, right? Being able to talk to their neighbors, knocking on someone's door to do a wellness check and being scared because you don't know who lives there or what's going to happen at the other end, stuff like that. Folks talk about different silos in different communities and not coming together. And I heard a lot about resources and not having the right resources. Like somebody talked about boards where you can walk through your neighborhood and see a board that's posted maybe with lots of resources and where you can get food, how you can stay healthy, that kind of stuff. Folks talk about funding as well. They were talking about some of the work that Sammy, somebody mentioned that, and he does it all for free, and they hope that he's funded. And there's a lot of other work that goes on in the community as far as wellness we don't know where the funding is coming from, or even if there is funding, but people are, going way and beyond just to make sure that certain things happen. So what I heard a lot of was lack of funding for the great work that some individuals are doing, and lack of resources to let folks know about some of the great work that's actually happening in our communities. Like things happen and some of the people know, and a lot of the people never even heard about it. So these are just things that we have to change, and try to make sure that we have these resources and we create avenues for funding for all the great work that they're all doing.
Yeah, and it definitely takes all of us. I know this is not the last time we will be talking about this, but I love that we started this conversation tonight. So first of all, I just want to say thank you to our facilitators for navigating those conversations with us. I appreciate the four of you for your leadership in the community and creating a safe space for us to start this conversation, right? Especially as we at Vital Connections are looking to bring people together in order to bring the health solutions right into your community with the community health hubs. So thank you so much to our facilitators. So I just want to shout you.
Yeah.
I just want to shout you all out. You did a great job. I popped in between the rooms. I wish I could say, and I know a lot of people were like, I think that these need to be like their own convos. Trust me, this is not the end. I feel as though I definitely want to create opportunities for us to have deeper dives into all of these things, because I think they're all pieces to the puzzle. So definitely stay tuned. So
thank you, Diana. Thank you, Vital Connections, for putting this on. Like I said, one of the things that people say as far as resources and community wellness was concerned, that there are not enough events like this happening. So,
yeah. Well,
Quick thing.
Yes.
We love you. We love you. We love you. And know that you are not alone. We love you. Know that you are not alone.
Yes. Oh, thank you, Sam, for those words.
Yes.
So,
thank you.
Thank you.
Yes. So everyone, don't hop off yet, right? Definitely want to give a final, just a final thought, just to kind of wrap us up and give you a couple important things before we all go off to making our own wellness plans. I just want to say thank you to everyone who was involved tonight, our great panelists, our facilitators. Again, thank you so much for guiding us through those conversations. And you all, I think all of you community members, one, for your patience, because Zoom can be tricky. And I know all of you have been graceful and patient in making sure that we have these conversations. So I want to say thank you for that tonight. We talked about a lot when it comes to creating our own wellness plan and taking ownership of community wellness, because it does take all of us to be a part of the solution. Whether you're a community member, whether you're a part of an organization, you work in the healthcare system, we all play a part in making sure that we are all well. So before we close out tonight, I'm going to put a link in the chat. This is our event survey. We would love for you to fill it out. This will let us know about the community convo you experienced tonight, give us feedback on how it's going, but also it'll give you all an opportunity to talk about your definition of wellness and what we can do to make sure, as we re-engage around our community health hubs, which are going to be, for lack of better terms, pop-ups in the community, in collaboration with different organizations, to make sure we're bringing these health solutions right to your community. So, we'd love to hear your thoughts. Please fill it out. Also, because we always love a little humdinger with that. You can fill it out, and you can be entered into a drawing for one of 4 $25 gift cards. Ooh! So you can get those good groceries. at Daily Table with that coupon Terry was talking about. Maybe a couple dumbbells from Five Below, because I know at that one we were talking about some good deals. So there's a lot of good things you can do to make that to use towards your health and wellness plan. So would love for you all to fill that out. Those that are selected will reach out to you via email. But otherwise, if you have any other ideas, you're passionate about some of the things you heard about tonight, feel free to reach out to me. I will put my email in the chat. It's Ayanna, AYANNA at Vital, VITAL, CXNS.org. Feel free to reach out. I'm here. I am the Director of Community Partnerships, so I'm here to figure out how we can work together. So with that, have a good night. Stay well. Put your meditation music on, because I know I will tonight. I might be joining Sam's meditation call tonight. So there's a lot of great ways we can kick this off. So, have a good night and be well.
Can Sam put his link in there?
Yeah, Sam, go ahead. Put your link in there one more time. So that way, if anybody wants to join you at 9 o'clock, they can.
And thank you all, everyone. This was great. Thank you.
Yes. All right, everyone. If you want, we're gonna put some more. Links in the chat. I'm gonna put my email, and then with that, have a good night.
Good night.
Good night.
Good night, everyone.
Good night.
All right.
Thanks for coming.
Good night, everybody.
everyone.
Thank you.
Good night.